Hi, I'm Dr. Seng Xue Wei. Intrauterine insemination is a fertility procedure that involves placing sperms inside a woman's uterus at the time of ovulation to facilitate fertilization. The goal of IUI is to increase the number of sperms that reach the ovulated egg and subsequently increase the chances of fertilization. This procedure is often combined with fertility medication to increase the chances of conception. Any couple who has unexplained infertility, mild main factor infertility, cervical factor infertility, and mild endometriosis can undergo this procedure. However, the patient must have normal fallopian tubes, and her husband should have sufficiently good quality sperms. Common conditions that require intrauterine inseminations are unexplained infertility, low sperm count, decreased sperm mobility, requirement of donor sperm, ejaculation dysfunction, endometriosis. Depending on the cause of infertility, some patients may need to use fertility medication alongside their intrauterine insemination treatment. If fertility medications are used, it is called a stimulated cycle, because the medications used stimulate more eggs to grow. If medications are not used, it is called an unstimulated cycle or natural cycle. Most doctors would encourage women to take fertility medications to stimulate the ovaries to increase egg production. This is done in order to improve the chance of achieving pregnancy. However, there is a risk of getting multiple pregnancies while taking fertility medications. For unstimulated cycles or natural cycles, intrauterine insemination is timed to take place at the time of natural ovulation. The patient may be asked to detect ovulation using an ovulation predictor kit, or your doctor may track your cycles using blood tests and ultrasound scans. Intrauterine insemination is usually done between day 12 and day 16 of a natural menstrual cycle, but the exact day will depend on your individual cycle. In a stimulated cycle, fertility medications can be given in the form of either tablets or injections. The patient will start taking medications near the start of their menstrual cycle to stimulate the ovaries to develop several mature eggs for fertilization. Serial ultrasound scans can be done to help track and locate the eggs and check its maturity. This will allow insemination to take place at the optimal time. The patient may either ovulate naturally or be given an injection of a hormone called HCG to start ovulation. Once ovulation has been detected, the insemination is usually performed within 24 to 40 hours of detection. On the day of insemination, the semen sample will be washed by the lab to separate the semen from the seminal fluid. A catheter is used to inject the processed sperms directly into the uterus. This process maximizes the number of sperms that are placed in the uterus, thus increasing the possibility of conception. The IUI procedure takes little time and involves minimal discomfort. And finally, the next step is just to watch for signs and symptoms of pregnancy.